Chronic pain is one of the most widespread health issues in the world. It affects tens of millions of people, limiting movement, interfering with sleep, causing depression and draining joy from daily life. But here's the problem. For decades, we've relied on treatments that often cause more harm than good. Opioids and NSAIDs have dominated pain management. They're everywhere, but that doesn't mean they're the best or even safe long-term options. Let's talk about opioids first. They can be effective for short-term pain, but they come with serious risks: tolerance, dependency, and tragically, overdose. Between 1999 and 2020, more than 500,000 Americans lost their lives due to opioid overdoses. That's not a statistic, it's a crisis. Then there are NSAIDs like ibuprofen and naproxen. Common? Yes, but safe? Not always. Long-term use can lead to stomach bleeding, kidney problems, high blood pressure, and heart attacks. Remember Vioxx? That drug alone was linked to around 60,000 deaths before it was pulled from the market. So where do we turn for a safer, more sustainable solution? Cannabis. Cannabis-based therapies are changing the pain relief landscape, and the science is catching up. Clinical trials have consistently shown that cannabis can effectively reduce chronic pain, especially for conditions like neuropathy, cancer pain, multiple sclerosis, and inflammatory disorders. Take Sativex, for example, a pharmaceutical cannabis product containing both THC and CBD. It's one of the most studied cannabis medicines to date, with trials showing strong reductions in pain and improved quality of life. And unlike opioids or NSAIDs, cannabis has a much gentler side effect profile. Typically mild things like dry mouth, fatigue, or lightheadedness. But here's what really stands out. Cannabis may help reduce dependence on dangerous drugs. In a 2016 study, patients who added cannabis to their chronic pain regimen reduced their opioid use by 64%. A Canadian study echoed this, showing cannabis users were less likely to rely on prescription opioids over time. And that's just the beginning. Cannabis also brings anti-inflammatory and neuroprotective benefits, which are especially promising for conditions like arthritis, fibromyalgia, and even post-surgical pain. Plus, there's virtually no risk of fatal overdose. That's a major public health advantage. So, why are we still treating cannabis like a last resort? It's time to shift the paradigm. Cannabis should be a first-line therapy, not an afterthought, not a backup plan, and definitely not just for when nothing else works. We need doctors, policymakers, and patients to rethink the role of cannabis in chronic pain care. That means reforming outdated laws, supporting more research, and making medical cannabis accessible and affordable to the people who need it most. Bottom line, people in pain deserve better. They deserve effective relief without the high cost of side effects, dependency, or life-threatening risks. Let's be bold enough to say it. Cannabis works. It's safer. And for many patients, it should be the first choice, not the last.